Hey, I'm Quincy and I'm a radio personality, but just like you, I'm always wanting to make better health choices for myself and of course for my family. Now that's why I've teamed up with my friend Dr. Dean Tyndall and the fine folks of New Life Naturopathic, the creators of new-lifeweightloss.com, to bring you a podcast focused on giving you the information you need to make the best health decisions for you and your family. Now, that's going to be without sway from what mainstream medicine has become. Now, this podcast, Pursuit of New Life, we're going to release one each Friday. And we're going to focus on debunking the mainstream medicine myths now associated with naturopathic, holistic medicine, while giving you clear insight into ways you can make your health a lifestyle and not a jump from fad diet to fad diet. Experts in the fields of biochemistry, chiropractic, physiology, women's health, and much more will weigh in on a range of topics, all designed to open your eyes, expand your knowledge, and bring you to new life. Now be sure to subscribe to Pursuit of New Life on all the podcast platforms, and also follow us on YouTube at newlifenaturopathic.com, and be joining us every Friday for Pursuit of New Life. Yes, we still are here again. We did a controversial episode last week, and so far we're good. This is Pursuit of New Life, and we're thankful that you're along with us. We're thankful that you are subscribing, making sure you tell your friends, download, share it, all that good stuff. Pursuit of New Life on your favorite podcast platform, and also on YouTube at New Life Naturopathic. So we did talk about a tough topic last week, and we're going to take another tough topic today, much more prevalent, really. And we're going to talk about diabetes, and we're going to jump right into it, and we're going to let Dr. Tyndall get us started, as always, since, you know, it is Dr. Tyndall and his New Life Naturopathic team from Elizabethtown, Kentucky, everybody in the team. And then, of course, you know, some people are from other places, but that's where the main place is there in Elizabeth. Shout out Elizabethtown, Kentucky. All right, Dr. Tyndall, take us away.
Hey, Quincy. So diabetes, huge problem in America. And it's a very easily preventable problem in America. That's a sad thing about it. It's probably 99% of type 2 diabetes is caused by ourselves, by what we eat, what we're consuming, what we're drinking, all that stuff. Small percentage, you have your pancreas gets messed up from infection or things like that. But for the most part, it's lifestyle, dietary. The great thing about it being lifestyle dietary is you can reverse it if you have right people who know what they're doing to help you get to back that spot. So basically, we got a graphic that we got up here. We're going to kind of explain how it happens. So if you consume simple carbohydrates, which is bread, cake, cookies, pops of sugar. I know I say that really fast because I said it about a million times. It elevates your blood sugar levels. So what happens is your body response is high sugar. And if you follow kind of the red, if you're on YouTube and you're watching, we're going to kind of follow the red line first. So what happens, it promotes insulin release from the pancreas. And that insulin then stimulates glucose to be uptaken out of the sugar into the tissues. And also it can stimulate the liver to make glycogen. Now, if you move over to the right side of or the left side of the screen, high blood sugar levels, the insulin also stimulates the fat cells in your body to uptake the glucose out of the bloodstream. And the goal of all this stuff is actually to normalize your blood sugar levels. And so what happens with diabetes is, as you're doing this kind of the process of stabilizing my blood sugar levels, when you hammer that pancreas for a long period of time, the pancreas can several things happen. Your cells become resistant to insulin, the effects of insulin. And your pancreas kind of basically gets to the point that it burns out. So what happens is you can't regulate your blood sugar levels anymore. And then so you start to see those blood sugar levels start to creep up. The traditional route that doctors will use for you, if you're kind of at the beginnings of it, they'll put you on like metformin and some of these other products. But the problem is they have very, very serious side effects. And then if you keep going, if you continue down that path of the bad eating, because the MDs aren't going to, most MDs will tell you, oh, eat healthier. they have no clue. So that's why they just say, eat healthier. And what happens is you don't eat healthier. And I've actually seen guys come back from when they go to the hospital for their class, eating healthy class at the hospital, and the dietitians will tell them, oh yeah, you could eat like pancakes and waffles. And I was like, what the heck? And they'll think, yeah, as long as you take your metformin, your insulin, you're going to be fine. And I'm thinking, holy crap, hold on.
That's why people get stuck in this cycle.
Yeah, they get stuck. You know, I tell people all the time, I'm not trying to be mean about it. It's just the reality of it. It takes a lot of money to run these hospitals. It takes a lot of money to pay these doctors to keep their lifestyles up. So guess what they want to do? They're going to find a way to manage your sickness. It's not healthcare anymore. It's managed sickness care. And what we're going to do is sell you a lot of drugs, do a lot of testing on you, and we're going to make a lot of money off of you. And that's why I kind of get flabbergasted sometimes, because when we put our eating program together, we were kind of debating on prices, and we purposely kept the cost of the program low. It's like $39 a month, and if you do like up to a year, it's like $33 a month. And the reason we kind of did it that way is because our goal is to get as many people as we can to have access to good information at a very reasonable price, so they can get their health back for themselves.
Yeah.
That
eating program is new-lifeweightloss.com.
Yeah.
You know, going back to the graphic, we were talking about how diabetes happens, how all this works. You basically said the pancreas gets worn out. So this is another situation where we put such stress on an organ in our body because of our lifestyle choices that it can't do its job anymore. It's like when we don't get the right sleep cycle, or we don't eat at the, we don't have the right time in between eating for our body to cleanse and do jobs, right? Is that what I heard you saying? It gets so overworked that it flat wears out.
Yeah, because just look at if you look back at about 100 years ago, I think that average consumption for a person of sugar, with having sugar in their diet, was something ridiculously low, like maybe 5 pounds a year, 10 pounds a year. Yeah. Nowadays, I think it's over 100 pounds of sugar, the average person. So I don't do any, I do probably, I only think if I do a pound of sugar in a year. So who's taking my 99 pounds? You know what I'm saying? But that, in the patients, we get it all the time. They come in, and what's really flabbergasting, frustrating for us, first of all, the doctors don't really do the right blood tests. What you really want to do when you do your blood tests, you want to do your fasting blood sugar levels, your A1C, and your fasting insulin levels. None of the doctors really do the fasting insulin level. We do that one. Then the reason being is you want to see what that insulin level is. Optimal is 2 to 5. Now the lab, depends on the lab, we'll run up the high is 19 or 24, depending on which lab that they use. Well, if you're supposed to be, say, at 5 and you're at 19, or let's say 20 for easy math, your pancreas is producing 4 times the amount of insulin it needs to manage your blood sugar levels. And what we're looking at is the reason we want to run these numbers. We're looking at, okay, you're starting to get out of this range. We don't want to wait till you're completely full-blown diagnosable diabetic. We want to catch you before you become that impaired with your blood sugar handling in your system. So what we're going to try to look at is, again, we address it from all aspects. We're going to talk to you about your diet, because that's the cause. Mm-hmm. We're going to talk to you about your exercise, because that's how you can get those blood sugar levels down quicker. And then we're going to talk to you about supplements that we can use to repair your pancreas. Like Gymnema from MetaHerb is a great product. There's research that actually restores your beta cells of your islets of Langerhans. We can rejuvenate them. It takes about 18 months. That's on the research. We got other great products like Metabolic Complex. Because people don't realize is that there's so many other health factors. There's so many health problems that's associated with diabetes. And then we got a graphic here that we're going to throw up here.
Yes, we are. That talks about what can happen, the complications.
Complications of diabetes: stroke, high blood pressure, diabetic retinopathy. Basically, you start to go blind. Diabetic neuropathies, or not neuropathy, neuropathies, and you got nephropathy, where you're destroying your kidneys. That's why, like, your doctors will check your sugar in your urine. If you're starting to push sugar through your kidneys, you're damaging those kidneys. Other eye complications, poor wound healing. So we see patients all the time that they'll cut their leg and it doesn't heal. Cardiovascular disease, diabetic ulcerations on your foot. Again, they don't heal. Cognitive decline. And we're going to be talking about this later as Alzheimer's, because Alzheimer's is basically type 3 diabetes.
So we talked a little bit about getting stuck in the cycle. And we know that people will say, well, it's in my family history, it's in my genes. Is that any part of this?
Yeah. So some people are going to be more genetically predisposed to problems. There's a great, Nova did it. It's on epigenetics. It's called The Ghost in Your Genes. And what was really cool is this country in Europe somewhere, they're isolated. So they had to keep real controlled records on the foods, how they grew their foods and how much food they had, because they had like portioned it out for the winter. Okay. And so they had been able to keep records of this stuff for a couple hundred years, I believe. And what they found was that if they had a harvest that was really plentiful harvest, the kids that were born the mothers that were pregnant during that time, the kids were born and they had a higher incidence of having diabetes than kids who were born during times of famine, because that sugar and that exposure to those grains altered their epigenetic covering on their DNA, so that left them more susceptible to having diabetes. So yeah, there is a factor in it. So again, when we deal with infertility problems, like women who are trying to get pregnant, a big thing that we do is we again fix the diet, because like PCOS is, I call it type 4 diabetes. PCOS is a sugar problem. A lot of infertility problems is bad dietary problems. And what we do with a lot of our ladies is we tell them, give us 6 months to a year, and we're going to clean your lifestyle up, your diet, and we're going to do some stuff to repair your hormonal system, because your hormonal system's so out of whack. And guess what's the number one, we talked about it before, is sugar that throws out your hormonal system. Yeah. So what we find is that when we get these people, husbands and wives, that's why I say people, eating healthy, they can start to have babies.
Yeah. Well, Dr. Stuber, since we're talking about, your neck of the woods there, women's health, what's your perspective on diabetes and what you're seeing in practice?
Well, what I say is diabetes is the real pandemic. Excuse me. It is so common. I was looking up some statistics, and I think the numbers were something like 60% of people are pre-diabetic, 30% of Americans are diabetic, 60% of them are pre-diabetic, and of those, 90% of them don't even know they're pre-diabetic. So
that's some big numbers.
Yeah. And people don't realize that diabetes, they associate diabetes with sugar, and it is a sugar handling issue, lack of insulin or too much insulin and lack of insulin. And it's a cardiovascular disease, because what happens is your blood with all that sugar in it gets sticky. And so when you have sticky blood, the tiny little capillaries, the tiny arteries that supply blood to like your eyes and your kidneys and your feet, the further away you get from your heart, they clog and they don't work. And so that's why you see people losing their limbs. And of all people that have diabetes, something like 90% of type 2 diabetes is preventable. And when you look at all the diseases that are caused from diabetes, like Dr. Tyndall hit out some of them, eye disease, kidney disease, heart disease. They've linked diabetes to Alzheimer's with the hardening of the arteries in the brain. stroke, and I forgot. I lost my train of thought. I'm sorry.
Oh, you're okay. You were talking about the complications of diabetes, and we've got that graphic back up.
Yeah, the
You're talking
complications
about all
of
the different things.
So all these things, when you look at all these different diseases, the bottom line is that most of them are preventable with a proper diet. And, the other thing that really helps prevent diabetes is exercise. Regular cardiovascular exercise, it drives that sugar into the cells. It makes the cells less insulin resistant. So your pancreas doesn't have to work so hard and gets that blood pumping. But really, people say to me, "Oh, I hate exercise." And I'm like, I do too. No, I am not one that I don't like exercise, but I do it. You know why? Because I don't have diabetes. I want my heart to be healthy. I want to be able to see. So we need, as adults, there's a lot of things in life we don't like to do, but we need to do. Denzel Washington always says we can do what we have to do so we can do what we want to do. And that's just, not to mention the cost. The cost of diabetes to the American economy is absolutely staggering. We're already broke, but it's just not sustainable.
Yeah.
We have insulin shortages. They trying to create new drugs faster than they can even create them because
people want to keep eating the way they eat. Yeah.
They used to, American Cardiologists Association just came out with a study. The first one that I've seen, Dr. Tyndall sees more studies than I do, but they're saying they came out and said that sugar and diabetes are the number one causes of heart disease. And it kind of shocked me because we've been saying that, how long? 30 years? But I don't know. We learned that in college, I think, didn't we?
Since we got into healthcare.
Yeah,
actual healthcare.
40 years. And so, and I'll just share a personal experience. My father had heart, it was genetic, but also lifestyle. My father had heart disease, hardening of the arteries. And I'll never forget, he had his first heart attack. So they put him on the cardiac diet, which is basically eat cardboard. It's basically eat everything dry, no salt, no fat, which is probably the worst thing you can do for your cardiovascular system. It increases other problems. So it's just a real problem. I see younger and younger and younger people. When we test the fasting insulin, like Dr. Tyndall said, maybe at the most we want to see it at 5, and I'm seeing people close to 30. And they're young. So I can't imagine what they're going to be when they're my age. And see, when you have insulin that high, everything becomes insulin resistant. And the earlier you get that problem, everything's going to short circuit sooner. So we're seeing the diabetes problems happen younger and younger and younger. I see teenage young ladies that are taking pre-diabetic medicine simply because they won't quit eating junk food. I don't understand it. I really don't. I don't understand why a young person wouldn't want to be healthy. I don't really understand why everybody wouldn't want to be healthy, but it's a pandemic.
Yeah. Well, when we see the commercials for the new tools that, so you don't have to do the finger prick anymore, they've got an app and you can put a little thing on you and it tells you your sugar levels and all that stuff.
And the fact, like the lady, there's people, again, I'm not going to name names. I don't want to get into any controversy, but they're coming out with, we use these diabetes medicines to lose weight. Like, it's really unbelievable. Dr. Tyndall or Marion can talk a little bit more about that. But when I see Weight Watchers and everything saying, with these new medicines, we have to change the way we think because that's just the reality. Why somebody would want to inject themselves just so they could eat whatever they wanted with the perception that, I can eat whatever I want because I take this medicine. It doesn't work. I mean, the average weight loss on these things is maybe 5 pounds, I think, is what the studies say. So it's amazing what the media puts out there and what people believe. You know, I always try to tell people, have just a little bit of common sense. Think before you act.
Yeah, go ahead, Dr. Tindall.
What I think is fascinating, I think the shot is like $300 a month or $300 a shot or something like that. I think it's $300 a shot, and they do it once a week.
Mm-hmm.
Wow. So here's why it's irritating. You people, I can't afford to eat healthy. I think no wonder you're spending $1,200 a month on a shot.
And they charge people for $100 every week to go step on the scale. The lady was telling me that. I'm like, you're kidding me. They charge you $100 to go in and step on the scale to see if the shot's working. But then if the shot's, you haven't lost, 37 ounces, then they increase your dosage and make you come back sooner. So it's ridiculous.
And of course, the lawsuits are hitting on it already, because if the one that starts with an O, because it causes gastroparesis in your small intestinal tract. So it destroys or paralyzes your small intestine, so you can't move food through it. That's one of the reasons why you don't have the appetite anymore. So now you're going to have your intestinal tracts done surgery on because you're taking a drug, and I think it's funny because I do some house calls, and one of the few probably people that do house calls anymore. Sometimes I have a patient's house, and one of them is there's this commercial for A1C. Oh, your A1C, which most doctors, I know it sounds funny, have no idea what A1C means or what the significance of it is, like physiology. And we'll probably talk about that maybe today or some other time. But you got this one commercial. I see this lady's at least 210 pounds, and she's dancing and singing. And then of course at the end of it, there's like 30 of them dancing and singing around a fountain. Take this drug, say your A1C, and of course the guy then you have the voice underneath it. It causes death. And if this happens, see your doctor immediately. Or if you have this, see your doctor immediately. And I sit there in the TV and after the commercial's over, I said, or you can eat healthier.
Yeah, I want to know, do you do the dancing at the house call? That's what I want to know.
No, I don't do the dancing.
Oh, okay. Just checking. Only on the podcast.
I'm there to make people feel better, not sick.
Okay. So I think, we need to have a prevention jar. You know how people have curse jars, and if we could make a lot of money how often we mention prevention on this podcast. So we have mentioned, though, that there is some genetic proclivity to what we're talking about today. And Miriam, I know from your perspective, you've had some family that have dealt with diabetes, but we've also talked about how even if there is the proclivity to it, there's also decisions that come to that. So what perspective do you want to give on that today, Miriam? And then we'll come back to Dr. T to wrap things up in a moment.
Sure. I hope my camera is not going too slow. Are we good?
It's doing okay. We always have, when we have multiple internet streams coming on a show, there's always going to be something going on. And shout out to Miriam's mom for the necklace. It's very nice. For those watching on YouTube, you can see that.
Thank you very much, Quincy. Thank you. Appreciate that. So yeah, as Dr. Tindall mentioned, yes, of course, some people are more genetically predisposed, have a family history of diabetes, but that's pretty much only 5% versus, the other 80 to 90%, which is lifestyle. And that's basically what we want to focus on. The genetic stuff can be taken care of by other means, we have pretty innovative medicine nowadays, gene therapy, stem cell therapy, all that great stuff. But right here, we're talking about lifestyle. And as far as my family, I've definitely seen firsthand how diabetes can creep up on, family members or people who get too comfortable with a certain lifestyle, or they think that they can get away with it, or it's not going to affect them, or they simply don't care, which is also sad. But I've definitely seen, family members who started smoking, eating sugary foods, stopped exercising, basically did everything in the book to lead to their diagnosis. And that's basically what happened. And the ones who stayed in a healthy lifestyle did not get diabetes. So you know, it's not anything too magical. It's just taking care of yourself. And, we can also help with that. And yeah, like Dr. Tindall was also mentioning with the commercials, it is very unfortunate that we live in a society where now it's more and more acceptable. I mean, body acceptance is great until it affects your health. And that's, another thing we want to really delve in on is, you can only get away with it for so long. Your body's not made out of metal. You're not a robot, unfortunately. So you got to treat it that way.
Yeah, that's true. And we come back to lifestyle and prevention again. Dr. Tindall, as we come to the end of another episode of something that is affecting a lot of people because of choices, because of all the factors we've talked about today, what's something you want to leave people with today that maybe can give them a little hope? I think you said at the beginning of the episode, hey, this can be reversed if you start making the right decisions. So that may be something you want to maybe hammer home a little bit more here as we wrap up.
Yeah. So just kind of real quick, I did a radio show interview on Sage Bonato, and it's on what's that?
I think you said in previous episodes that it was called AMP, and you were going to start in on.
It was AMP. It's through Amazon. Mm-hmm. Anyhow, I was on his show, interviewed Beanie, and going to be back. But we had a guy called in actually, and he goes, "I got type 2 diabetes. What do I need to do?" And I'm like, he thought, I'm going to get this 5. That's the problem with everybody. I want the 5-second answer.
Then it lets me do what I want to do.
Yeah,
right.
For decades of problems that I've done to myself, and I'm like, I told my siblings, the best thing for you to do is hire me on our New Life, naturopathic weight loss, or not the weight loss, newlifenaturopathic.com, because we do telehealth and phone calls and online health, and because we send the paperwork out, we send the labs out to people and all that stuff. But yeah, and it is frustrating because I had a couple of years ago, I had a patient of mine, and I'm like, he's got diabetes. I'm like, look, you need to get your diabetes under control. And he had a wound on his foot. I said, look, this isn't going to heal. I said, no, this is beginning before we had our program, because I tell people this is what you need to eat. Of course, people we used to give a cookbook, and there are people and they don't want to follow it because again, they want to stay with what they're doing. And it's really sat him down. I said, look, I'm serious. You got diabetes, you got this bad wound on your leg, and they're going to cut it off if you don't start taking care of this thing. And he was like, oh, no, doc, my other doc said I'm fine. I'm like, no, I'm telling you, you're going to be losing this leg if you don't watch it. So a couple of weeks go by, and then all of a sudden, I'm adjusting him and kind of like, listen to me. And all of a sudden he doesn't come back for about 3 or 4 months. I'm like, crap, I must have really made him mad. And next thing you know, I see him on my schedule. I'm like, oh, he's back. So I come in, and his left leg is cut off just underneath the knee. I think they left that much so they could put a stump. I walked in and I saw his left leg gone, and I said, all I need now is get you a patch. This is when we were joking about the Pirates. I told him, I said, I need you to get you a patch, a peg leg, and a pair. And I said, you'll be all set.
And the thing is, you told him, and that's why, that's why it's a little comical, because you gave him the warning signs. You told him what he could do and didn't. Yeah.
And what I thought was really funny, he goes, I want you to tell you thank you for not feeling sorry for me, because you did tell me. And he goes, you warned me, and you kept warning me, and I wouldn't listen. He goes, it's all my fault. And I go, well,
lessons learned. Yeah.
You can change now, and you can start kind of eating healthier and kind of get back on that path. And that's again, a frustrating thing for us, because we see where you're heading. When we see these young kids, like Julie was saying, that are overweight and having these problems, we know your future. We know that you're going to have all these health problems. We try to warn you, and if you don't listen, that's our goal. That's what kind of motivates us, is we want to try to get you healthy, or tell patients that come in for chiropractic care that our office is about healthcare. It's about getting you healthy, trying you to be the best you can be, and as healthy as you can be.
Yeah. Well, and that's what we're about on this podcast as well. If you're watching on YouTube, New Life Naturopathic, they're on YouTube. You've been seeing us put this up. It is new-lifeweightloss.com. Very affordable, great way to get yourself in a good position to eat better and make better lifestyle choices. newlifenaturopathic.com. You heard Dr. Tyndall mention it earlier, because they can help you from anywhere. So if you're listening to the podcast and think, oh, I'm not in Elizabethtown, Kentucky, it's okay. Go to newlifenaturopathic.com and they can still help you out. We have covered a lot today in diabetes. We covered last week, we talked about COVID. So, we will approach the tough topics. We want to give you information that'll help you. Your holistic whole self is what we want to treat. And we want to make sure that you're making those decisions and you have the information to make those decisions. And prevention, as you've heard us say many, many times. Folks, we want you to, now it's just me and Dr. Tyndall left, the ladies left us. They, sometimes we get going and we talk too long and they just have to go. But internet issues also sometimes come into play. But for Dr. Tyndall and the New Life Naturopathic team, we appreciate everybody that's come along on this holistic journey with us. We encourage you to share it with your friends and download, subscribe on your favorite podcast platform, Pursuit of New Life, and also New Life Naturopathic on YouTube. And we'll see you again next week on Pursuit of New Life.
All right. Thanks, Quincy.